So one of the really phenomenal things about the antiretroviral therapies that we have is that they do significantly prolong life. We can get the virus to undetectable levels, which means, of course, it can't be transmitted through sex or through sharing needles or other mechanisms. That's a very good thing. HIV is an inflammatory disease. It causes changes in the body's physiology, and the way the immune system reacts is through this response that we call inflammation. And so when you think about this inflammation, if you look in the blood, you'll see some of the same types of chemicals that we might see in a person who has rheumatoid arthritis or lupus or this inflammation. What this tells us is that there's some damage going on. There's damage as a result of the infection. When we give the medications, the HIV drugs that suppress the virus, this inflammation goes down a lot, but it doesn't go away completely. So we've got this lingering inflammation that's going on. And over time, this can cause problems, say, for example, in the blood vessels. It can cause a condition that we call atherosclerosis. And so what this means is that we have to be super vigilant. These are discussions that you need to be having with your medical provider on how to minimize your risks for this condition, for atherosclerosis. This means that if you have high blood pressure, you got to control it with the medication, staying on top of your blood pressure. We did a study at the National Institutes of Health, and let me just say that everything that I mentioned, I'm not wearing my NIH hat. So don't go back and say, well, the NIH says such and such. No, NIH didn't say anything. Dr. Crawford said it. So this is my experience, my perspective, not the NIH official response. But we did a study where we used a type of drug that we call a statin. You've probably heard about these statins. They lower cholesterol. They lower triglycerides. They control some of the lipids, the cholesterol, triglycerides that can cause harm. And we gave this particular statin to people living with HIV.